Hi, no mai, haere mai. Welcome along to our first of the Aphasia Aotearoa series. We're bringing together experts in the aphasia world to talk to us about their work. Ko Maldaikina hou no taupo e noho ana kei AphasiaNZ e mahi ana. Nō reira, tēnā koutou, tēnā koutou, tēnā koutou katoa. Today, we have the pleasure of talking to Associate Professor Felicity Bright. She works for the Auckland University of Technology. I'm going to let her introduce herself further. Hi, Felicity.
Kia ora, thank you, Mel. No ingarangi no kotirana o ku tipuna, engari tupuakia hau ki ōtautahi no tāna ki makaurau toku kāinga anainei. Ko Stedman toku whānau, ko Felicity Bright ahau. So hello, I'm joining you from Tāna ki makaurau, Auckland, where I've lived for nearly 25 years now.
Awesome. Well, thank you for making time in what is a busy schedule, I imagine. So we're grateful that you're here today. So we're here today to talk about communication access. We're highlighting that theme on our social media this month, and Felicity is an expert in that area. So let's start, Felicity, with what is communication access?
Communication access at its heart is about finding ways for people to understand information and to get their message across. And there's lots of different terms that are used, but another term that often is used is something called communication inclusion. So how do we communicate in ways that really includes everybody in understanding and in contributing to the conversations that are going on?
Yeah, great. So what does so first of all, I guess, why is that important? Why is it important to have communication inclusion?
Well, we know that when you have aphasia and when you're in the healthcare service, or if you're just living in everyday life, it can be really hard to access what are often fast-paced conversations that happen with complex language that is used, and where people don't adapt their communication to make it easy for you to understand or to express themselves or to express yourself. And we know that there are some kind of quite significant problems if that doesn't happen. So you might not understand what's happening in healthcare. You might not be able to have a say in what decisions are being made about you. There's research coming out about people with communication difficulties being at increased risk of falls in hospital because you're not able to call for help, or people don't understand when you're actually trying to communicate what it is that you're needing or wanting. And actually, really fundamentally, communication is just at the heart of who we are as humans. It's how we have relationships. It's how we build and maintain our relationships with partners, with our children, our mokopuna. When we can't fully participate in that communication, it can impact on every part of our lives and our sense of who we are.
Absolutely. Just a human right, isn't it?
Absolutely.
So what sorts of things can we do to facilitate that communication inclusion or communication access? How does that look in reality?
So it can often look like the ways that people change their communication. So if you are a healthcare practitioner, or if you are the person speaking who doesn't have communication difficulties, you might do things like simplify your language, not using complex jargon, using simpler sentences, allowing some time in between sentences for processing. It might be using gesture and facial expression to kind of communicate. It's allowing time for people to process what is being said, and time to then formulate a response, whether that is by talking, by using their own facial expression or their own gestures. Things like writing. is often a form of communication that is used, and recognizing that any form of communication is really important to attend to and try and understand.
So I guess
Sometimes,
there's a, so sorry.
I was going to say the other thing that comes to mind is changing how we say things. So, for instance, sometimes if we just ask an open-ended question, like, tell me about how you're feeling after your stroke. Sometimes it can be a bit hard to answer and to put into words, but sometimes then modifying that by maybe giving some options, or if the healthcare provider maybe puts some options down on paper or draws some pictures, maybe those are some examples of how we can make communication more accessible for people.
Mm, mm. Um, and so if we think a little bit more along that, we often talk about this concept of the communication ramp as a means by which we can assist people who have a disability communicating. Can you just talk a little bit about that concept?
Yeah, so you're probably all familiar with wheelchair ramps. Wheelchair ramps are provided to help people get into buildings, to get over stairs, to get over the lips of buildings, and to make it possible for people to participate in kind of everyday activities in everyday spaces. And so some people have talked about communication access as about being providing the ramp that helps people get into the conversation, to be part of that conversation in everyday life. And so those techniques I talked about of simplifying language, giving options for responding, gesture, writing, those are some examples of that. But it can also be things like thinking about the environment. How noisy is it? How many distractions are around that, for anybody, even if you don't have aphasia, can really impact on things. It can also be, I think, as well, things like the attitudes of the communication partners. We've done some research with people with aphasia where they talked about they're reading the person who they're talking with to get a sense of, is this somebody who is interested in me? Is this somebody who is going to take the time to listen to me? Is this someone I can trust, that they're really going to hear what I'm trying to communicate? And those aspects of communication ramps or communication access haven't been talked about an awful lot, but they seem to be really important for people kind of having a sense of, can I participate in this conversation? Can I give it a go? Does this person believe that I've got something to say, that I'm worth talking to, and that they should take the time and prioritize listening to me?
It's a big one. How are we doing in New Zealand as far as communication accessibility on the ground? Are there
Mm.
places that are doing it well, or yeah, what's the
I
landscape like?
haven't I haven't been in stroke services for a wee while. So I am a speech therapist. It's been a wee while since I worked in stroke services, but I have done research in stroke services looking at communication between people with stroke and clinicians. I think there's a lot of variability. I think speech therapists understand communication access and are trying really hard to do it. But our stroke services are fast paced. They are often meaning that speechies are having to work on swallowing difficulties rather than communication. And it can be harder for speech therapists to share their knowledge and strategies with the other members of the team who are also really busy doing things.
Mm,
Um, and so I think there's a good intent, but I think there's a lot of variability. There's a lot of staff don't always understand what these strategies look like.
mm,
So I remember doing some observations in a hospital, and the speech therapist had written, use whiteboard above the patient's bed as a communication strategy. And I sat there for 2 hours and I watched 5 different staff members come along from all different healthcare roles.
mm.
Every single one of them looked at that. They all picked up the whiteboard, so they really tried to do something, but every single one of them used it differently. and none of them used it as the speech therapist intended. And so we've got a bit of a breakdown within our staffing systems and the communication that's happening there about how staff know what to do and how to help.
So I guess that, falls on the speech therapist and the team to then be doing some professional development around that with their colleagues in an already stretched environment, but it will help. The flow-on effect will help a lot of patients down the line.
That's what we're hoping. And I think there's other things we can do. Like, we're not always picking up who has a communication difficulty. That's not always clear in the notes. So staff don't always know. So they don't know that they should be using those strategies. But we've also got staff who are working with high caseloads. Like, I don't know how nurses do it, to be really honest, in stroke care. They are so stretched with really high caseloads. And there's a lot of research that has talked to clinicians about how they communicate and what gets in the way. And so time is a big one. And it's not just time, but it's the messages that staff are given about what they should be spending their time doing. And so, unfortunately, we then get some messages around, if I take this time, this means I can't do these other things that I need to do. And so I feel really strongly about the need to really raise the visibility of the need for communication access, that it is a fundamental part of quality care, and it's fundamental for safe care as well. If you can't understand and you can't express yourself, you're at more risk of unsafe care and some really negative outcomes. And so we're doing some work and research to really try and work with stroke services to raise both the visibility of the need for communication access, but also to support staff and to kind of rethink what happens in stroke services so that it is easier for staff from all of our healthcare disciplines to communicate in the ways that are going to help people access their healthcare.
And in a time for environment, but I'm imagining those strategies will be simple but effective so that they can be picked up by whichever clinicians are engaging with the patient.
That's what we're hoping, because we know that staff turnover, staff change. They change wards, they come from overseas, they go overseas. We need things that are easy to implement, and that make it easy for staff to know, what is it that I could be doing? And to kind of make those decisions about, I'm going to prioritize taking the time to sit down and listen. And I'm doing some other research around well-being after stroke, and we know that one of the biggest influences on people's well-being in those early days and months post-stroke is when they feel that somebody is taking the time to listen and to hear them. And that's everybody, not just people who have communication difficulties. So this is really fundamental. Good communication is fundamental for helping people adjust after stroke, make sense of what has gone on, and look to the life that they want to have and that's going to be meaningful and enjoyable for them after their stroke.
That simple act of actually just sitting down with the person is so meaningful, isn't it? The eye-to-eye contact, it just sends the message of time and listening. Yeah, just simple things like that can be really powerful.
And I think that's the thing that I sometimes find, I don't know if frustrating is the word, but a lot of what we're talking about is not rocket science. You know, again, there was a study that came out last year that showed kind of the impacts on patient satisfaction when a doctor just sat down next to them during a ward round rather than standing over them at the side of the bed. And one of the strategies they tried was actually making sure that every person had a chair in their bed space. And if there was a chair there, the doctor was much more likely to go and sit on it. And so those are some examples of things that aren't about more training. It's not about more cost or any time even. It's about having some things that just remind us to kind of be human
Yeah.
and to kind of just communicate in ways that all of us would like, that would help us feel heard, seen, known. Yeah.
Yeah, across the patient population. Yeah, just that's everybody, isn't it? Not just those with communication difficulties.
Absolutely.
Yeah. Well, that brings us nicely along to sort of be thinking about the research that you're currently engaged in, Felicity. I understand you're in the recruitment phase. Would you like to just talk about that research a little bit and who you're recruiting and if we can help?
Sure, thanks, Mel. So yes, I'm working with Clare, McCann and Karen Brewer, who are two speech language therapy researchers and academics at the University of Auckland. And we've received funding from the New Zealand Health Research Council to improve communication access in stroke services, which is really exciting to be getting some funding from a big funding body for aphasia research. It's awesome to
Really
have that.
great.
Really great. And so what we're doing is three stages. So our first stage is we're wanting to talk to people about what is important for communication access in Aotearoa, New Zealand. We're wanting to talk to Māori and to non-Māori people with stroke and family or whānau members. And Karen, who is Ngāti Rangi Whakatohia Iwi, she is leading a stream of engagement with our Māori participants, our clinicians, and our people with stroke and whānau. And we know from other work around Māori experiences of stroke services that it's not just about the transmission of information, it's about the hononga, the connection that's there, about the wairua, the felt space, the essence that is in this space. And I think that's going to really help us think differently about what matters for communication access in New Zealand. So we would love to talk to people with stroke who have had aphasia or other communication difficulties. We'd love to talk to family or whānau members. And those interviews could be together or they could be separate. And we'd love to talk to healthcare practitioners or anybody working in stroke services. We're also going to do some observations. So we're going to be sitting in stroke units and looking at what's going on here. How does communication happen? But also, what are all of the different pressures and different things that are impacting on how clinicians can prioritise communication? Because that gives us some clues about what we might need to think about to change things. So this year is about talking to people. It's about watching what's happening. Next year is about trying to design solutions to try and address some of those issues and those things that aren't working well. And then our third year, which is 2026, yikes, is about trying that out in a stroke service and evaluating and looking at what's working like we hoped, what's not working, what do we need to change, and working to make those resources that we develop publicly available for people throughout Aotearoa New Zealand and beyond.
Oh, that's such a wonderful project. It's really exciting. And I think, yeah, you're right at the beginning of what could be really just really big changes. And like we've talked about, they could be simple things, but have a really large impact on people moving forward and their experience post-stroke.
Absolutely.
Yeah.
And so I think for people watching, I think, Mel, you're going to pop a flyer up on the Facebook page and our details are on there. There's a link where you can see a video of some of our researchers if you want to get a sense of who they are and what the project's about. But we'd love to talk to anybody and you're welcome to contact me and ask any questions.
Felicity, did you mention, is there a time frame post-stroke that these people fall into?
We're particularly keen to talk to people in the first 12 months after stroke.
Okay. Yeah.
That's just because often it's easier to remember some of the specific things when it's not too long away. But if you're a little bit further down the track, but you're still able to remember what it was like in hospital and when you were able to, you could remember some of the things that went well, some of the things that didn't go so well, get in touch and we'd love to have more of a chat with you.
Fantastic. So yeah, as Felicity said, we will put up all the information we can on our Facebook page. And in the comments, if there's any flyers and things, I'll post them up too. Please feel free to post any questions and we can direct them on to Felicity and help this wonderful study recruit as many people as possible.
Awesome. Thanks so much, Mel. And
Yeah.
thanks everybody for listening, and just feel free to get in touch if you've got any questions or any comments.
Wonderful. Well, thank you so much for your time today. It's really exciting to think that there's things happening in Aotearoa that's going to, make communication access a normal thing across at least our stroke units, and then one day into the community and beyond.
Well, I mean, if we can't get it right in stroke units, then where are we going to get it right?
Yeah.
It's like,
Yeah.
given we know that about 40% of people have well, actually it's about 60 to 70% of people have communication difficulties after stroke. We need to be doing better, and we need to be getting it right. Fantastic.
Well, all the best with the research, and hopefully we can help with some participants.
Awesome. Thanks so much.
Yeah, kia ora.
Kia ora.